Hello, hello, everyone. Welcome to Tips and Tricks for Treating Pregnant Patients. Thank you for being here. And I am your host, Dr. Deb Davies. I'm just going to go ahead and get started. I want to first share a little bit about me. I may not have met you before, so I would love to just share a little bit about myself. So basically, I began in the Chinese medicine field a long time ago, in 1996. I worked for an acupuncturist in Fountainville, Pennsylvania, when I was in college, and it really changed my life. I was with this lady for several years, and I helped her grow her practice from a small one into a big one. And I was so impressed with all the things she was able to do and treat. So it was really awesome. Just, that was my start for Chinese medicine. So fast forward several years later, I'm living in California. I got pregnant. I had this is my first pregnancy. And so at term, my baby died because of a cord accident. And it was the worst thing that's ever happened to me. And it really rocked me to my core. And it kind of made me who I am and like why I'm so passionate about women's health and all of that. So, that happened many years ago. I did go on to have a baby, and my daughter is 21 and she's amazing. So I was very happy and lucky and blessed. So with my training, while I was practicing, I was working with patients and helping them birthing by being their doula. And after I had done that a few times, I thought, oh, maybe I should get some training. So I went and did this DONA training program. And I had researched, and I thought that DONA had the highest standards, the best whatever to do childbirth or to do doula work. And so I took the class, and it was only 21 hours. So when I went to certify, they had this thing, and it said, if you're serving as a donor doula and you have a medical license, you will not use your medical license while serving as a donor doula. And I just thought that's ridiculous for me as an acupuncturist, because people hire me because I am an acupuncturist. So I am going to use my medical license. So I am DONA trained, but I did not certify with them just because I didn't feel like that was ethical to do that. So one of my goals is to create training programs for acupuncturists for birth so that they can feel comfortable and safe with their acupuncture license going into the labor rooms. I also studied hypnobirthing, just a form of childbirth education. It's similar to Chinese medicine. It's mirroring nature. So I studied that, and then I taught that for several years, teaching the lay public how to prepare for birth and for optimal results. And then several years later, I like when I was in school and being in San Diego, I would always do symposium every year, is their annual conference, and study like whatever was being offered, because I was always faculty or whatever, and I just had it for free and it's in my backyard. So then at one point I was like, I really want to specialize, and I need to think about who I want to study with, and I'm going to like travel and study with those people. So for a couple of years in a row, I followed Claudia Sikovits. I did all of her trainings. It was like one of the height of my trainings, like for my career, doing labor and delivery at NYU in Brooklyn, New York with Claudia several years ago with a couple of my colleagues. I learned a lot and just blown away by what Chinese medicine can do in, labor and delivery. And also like how times had changed for 20 years prior, when I was working for that acupuncturist as a receptionist, to actually being in a hospital in labor and delivery doing acupuncture. Mind blowing. Anyway, a little bit more about me. I'm faculty at a couple different schools. I work at Yosan in Los Angeles. I work at Eastern School in New Jersey. That's EASATM, and I teach their OBGYN online. I also am a supervisor at Pacific College in San Diego, and I have several classes on Net of Knowledge or LASA OMS if you're in the US. For CEUs, I got published a couple years back. So I always just like to ask, how many years have you guys been practicing? How do you feel about treating pregnancy? Are you feeling confident? You can pop it in the chat or just let me know. But what I'm hearing from a lot of people is it doesn't seem to make much of a difference if they're a new or seasoned practitioner. A lot of people are really, really scared treating pregnancy. So I'm determined to teach you why we, as acupuncturists, play such an essential role in treating pregnancy and help you acquire all the right tools to feel confident in supporting patients throughout their journey of pregnancy, birth, and postpartum. Because what I hear is a lot of people are good at fertility, but then once they're pregnant, they're like, oh God, now what? So this is where I'm trying to come in. So these are our topics today. We're going to talk about statistics and some of the research that I've done and what's happening in the United States currently. We're going to talk about clinic comfort ideas for your pregnant patients. And then we'll talk about some pregnancy diseases, disorders that Chinese medicine supports, as well as treatment strategies for those. And then we'll just do questions at the end. So did you learn everything not to do with your pregnant patients in school, but not how to properly care for them during pregnancy, birth, and or postpartum? Does your fear of treating pregnant patients stop you from treating them? Or are you really great at treating fertility, but then you actually refer out once they're expecting? This is another thing that I hear often. So I want to get into the stats and why this is so important. So in the United States, in my research, this is what I could find for induction rates, anywhere from 25 to 31% here from these statistics. But what I feel like from my practice is about 50% of the women choosing to birth in a hospital are having inductions. So it is, a high number, and there is a lot of women going through this. So this is a very common complaint if you're treating perinatal patients, is there the concern of induction and going into labor before the induction actually happens. So what are the challenges with inductions? A challenge, it can be come challenging because there can be this kind of cascade of interventions where they might start the induction medications and then they might do an epidural and the blood pressure drops, or different things can happen. So it can tend to spiral into a C-section, an unplanned C-section, which can be kind of traumatic for some people. So yeah, it's also a managed birth. Once you start with a birth that is being managed, it's like once a managed birth, always a managed birth. And there can be problems with the uterus contracting after giving birth, leading to bleeding complications, and after the birth is often sometimes the most scariest. So anyways, moving on. So there was an article I found that talked about labor induction. And so just in summary, it was like you can stay on the safe side by avoiding these inductions when there's no clear need. There are many clearly effective and safer ways to reduce the likelihood of cesarean birth. So I think that like some hospitals and medical systems have become so systematized that it's just easier to go through this process, but can be harder on the women and our patients. So how to avoid an induction? One thing is that you can look at all the different hospitals and see what their induction rates are, see what their C-section rates are. And so starting to look at the different facilities and see what those are. For example, there's a website called cesareanrates.org, and you can look up all the different hospitals and the different what their C-section rate is. And I teach in LA, and one of the hospitals in LA has a 70% C-section rate. So it's like if that woman is planning to give birth at that hospital, these can be things to help them understand, like maybe that's not a good idea. Another thing could be to look into birth centers or midwives, like understanding the difference between midwives and OBs. And I think that's big for us to understand and know about in general, because midwives care for normal, healthy women having normal, healthy babies, and doctors or OBs care for sick women. having sick babies. So in most of the world, midwives are caring for the majority of women because the majority of women are healthy. But for some reason in the US, we have this switched where there's 90% obese. And so they're kind of looking for problems. So if you have a woman that might be, really into natural everything, maybe she's a yogi, she wants a natural birth, even helping people understand that they can have a midwife and that midwives are safe and wonderful options and can give them very different experiences with the birth. So I think it's really important that we as providers, as well as these pregnant women that we're supporting, help educate themselves on, why women are induced and what's the evidence, where is the no evidence. And the other thing is their due date. So when women get pregnant and they go to their doctor, they get an estimated due date, EDD. And that is like a stamp. It's such an important date. Well, sometimes they'll change that date, move it up, move it back. But if they're planning that date, then, so the average cycle, the average menstrual cycle is 28 days. And so the average pregnancy is 28 days times 10. So it's 280 days. Now, in the state of California, women are allowed to go up to 42 weeks gestation before they would induce you. So I think it's good to know, because if women have longer cycles, they tend to have longer gestation cycles. And we might have to try a little harder to naturally promote their labor at the end. And so if somebody has a 30, 32-day cycle, you might have to work a little harder than the woman who has that perfect 28-day cycle. So acupuncture or Chinese medicine can be incredibly helpful and incredibly supportive. So in the US, 1 in 3 women are having major abdominal surgery with birth. So about 32%. It's a lot of women. And when we look at like the trends, so I was born in the 1970s. And when I was born, the C-section rate of the US was anywhere from 7 to 12%. Now, the World Health Organization says C-section rates of any country should not exceed 15%. So 10 to 15% is ideal for a country C-section rate. Now we are more than double that highest number. So, and those rates can change, like I was saying, from hospital to hospital, city to city, state to state. This is showing anywhere from 22 to 35% C-section rates. So some of the challenges with having a C-section could be incredible pain. Lifting and moving even your baby initially is really, really hard. Having the scar tissue, some women feel rather traumatized because it was an unplanned. And some people are having challenges of pelvic floor dysfunction, loss of urogenital, or God forbid, fecal function, or sexual dysfunction. So, and this could also be infertility. So in this picture here, this was the worst C-section scar I ever saw in my practice. And so if you're working with infertility and they have had a baby and they did have a C-section, ask to see that scar, because that's something there. And so this scar was totally keloided. So this woman was coming for acupuncture, and I said, I can tell you right now, this is why you're not getting pregnant, because it was thick, it was wide, and it had been 2 years too. And so she went to her doctor. She told her, doctor, my acupuncture said, and so he said, bring your husband's sperm in next time you're ovulating. We'll do an IUI, uterine insemination, where they would just take his sperm that he ejaculates into a cup, place it in a tube up inside her vagina and into her cervix. So it's just trying to get closer to the egg kind of thing. Anyways, she went to the doctor, and when he got to the physical location of her scar, he was kind of said, wow, it is stuck. And he literally like jammed it through, pushed the sperm in. She got pregnant and had another baby. That was amazing. Truly amazing. So make sure you look at those scars. Some of the challenges of post C-section is, like, here in America, everyone's like, do more, be more, go make more, So I feel like there's a lot of lack of support with the recovery process. And it is a process of, 6 to 8 weeks is what they say, but it feels like a lot of time people are like, oh, toughen up, buttercup. And, all the focus moves from her right to the baby. And so mom is actually overlooked. And whether she's not eating enough, drinking enough, whatever, it's really can be extremely challenging. Those of you who've had C-sections, I'm sure you could attest to this. I'm going to show you a short little clip from a movie that came out long ago. Ricki Lake did this movie. She was a talk show host from the 90s. And I think it's very telling of where our birth world is for labor and delivery today, even in the US. So let me just show you this really quick.
Hospitals are businesses. They want those beds filled and emptied. They don't want women hanging around in the labor room.
Technology is technology. It's not stopping. So if you're going to have good stuff, you might as well use it to get the best outcome.
Maternity care in the United States is in crisis.
People don't have the information.
Medical decisions are being made for monetary and legal reasons, not because they're good for the mother and the baby.
This is Pitocin, which is the medication given through the IV that causes contractions.
Just check that she's on PIT. Just make sure that she's on PIT.
I asked to keep upping the PIT.
And if you're uncomfortable, we can always give you more.
Is this an improvement, or are we making things worse?
How often do you get to see a fully natural birth?
Rarely.
Almost never.
Everywhere else in the world, you see midwives attending 70 or 80% of all the births, and the United States stands alone.
You want to talk big lobby, big dollars, they can kind of call a lot of shots.
Accusations tonight that some hospitals are not being upfront with patients who are expecting a baby.
Cesarean is extremely doctor-friendly. It's 20 minutes. And I'll be home for dinner.
Basically, what the medical profession has done is convince the vast majority of women that they don't know how to birth.
If I could do that, I could do anything. To me, that's the power of birthing, and that is what we are taking away from women.
It wasn't an illness. It wasn't something that needed to be numbed. It needed to be experienced.
It was the most adventurous day I've ever had in my life.
I don't even have a diaper. I don't even have that.
I have to get there. I cannot have another contraction in this taxi cab.
Switch on a light switch and you go to the moon.
This is what I was after. This is what I wanted for my child.
Nothing compares to the privilege of giving life and the responsibility of that. Nothing.
Oh my God! 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 Hi! Hi! Oh my God! Hi! We had a baby! We sure did.
If you guys haven't seen this movie, I highly suggest that you watch it, and then also encourage your pregnant mamas to watch it with their partners. Absolutely 1,000% with their partners, so that they understand kind of what they're up against. It's really interesting. It used to be on YouTube for free. I'm not exactly sure if you have to pay or not, but it's certainly worth having. And it's really good because it shares a lot of what's really happening. And as we know, all pregnant women have to give birth. So if you're here in the US, it's like, this is what we're up against, So this is our reality. So, and then the only thing that changed from that movie in 2007 to now in 2023 is he says we were the second worst country with maternal mortalities, and now we are the worst in all developed nations. And that is so upsetting to me. Let me show you this. So the maternal mortality in the United States is almost 24 women out of every 100,000 women are dying in and around birth. So when you look at countries of similar nature, it's really upsetting to see, such low numbers. And, why is that with all of our technology and our money and all that stuff? It's mind blowing to me. So, and the maternal mortality rate is rising recently. So it's just kind of scary. It's really scary if women are birthing. And if you're a woman of color, you and your baby are 3 to 4 times more likely to die in and around giving birth. So we really, really need to share this with the communities and make them aware and educate and empower women so that, something has to change. Something really has to change. I recently did a talk with Israeli acupuncturists. They were telling me they have 3 out of every 100,000, and that number is down recently. And so I asked them why. Why do you think that is? And they said to me, the student came on and said, in every hospital in the country, there is a team of acupuncturists. And there was like 10 or 12 of them, and they rotate between the emergency room, labor and delivery, post-op, all the things. So it's just crazy. I feel like this is something that we can do. This is something where Chinese medicine can step in with pregnancy and birth and help so, so much. Women are so thankful and grateful. They're so happy with their treatments and with their care, and the success rate as well. And so it's frustrating to me teaching at 3 different colleges around the country that like everyone's terrified of treating pregnant ladies, and God forbid birth. So every pregnant lady is going to give birth. So I think it's something that it's really, really important that we actually learn how to care for women. It's not just about getting them pregnant, it's about keeping them pregnant, carrying to term, having a healthy baby, and a healthy mom afterwards. So it's the whole kit and caboodle. So I saw an article earlier this year from Acupuncture Today, and they were talking about acupuncture as being an essential part of the pregnancy team. And it's true. It's really true. Like, I think that from my experience, it makes such a difference when women have an acupuncturist, throughout their pregnancy. It's mind-blowing. So in terms of setting your clinic up for success with acupuncture and pregnancy, some of the things I recommend is having an adjustable table. Of course, if you can afford it, put it on your wish list, but the table that goes up and down and adjusts the back up a little bit. So that makes it a lot more comfortable for you and for them, as well as extra pillows. You definitely want a body pillow. It's a long, long pillow, and just extra pillows to help keep them comfortable. Another thing that I really blew my mind when I realized this, because I know nothing about Home Depot and tools. It's so not my thing. So you can go to Home Depot and get a box, and it has, however many you need. I had 3 rooms, so we had 3 doorbells, and you can actually program it to sound differently. And then you get 2 little plugins. You put it in your reception area or by the receptionist, and then in your break room. So if somebody needs you, you hand them the doorbell before you walk out of the room. There's some kind of amazing safety level that just feels great when you can do that. And so they just don't feel alone. They feel like you're going to come if there's a problem. And sometimes for pregnant ladies, that's really important. And the other thing is 40 Blinks. This is what 40 Blinks looks like. You can get on Amazon. You can get it at Bed Bath & Beyond. They're wonderful. It looks like a little face bra, literally. It doesn't mess up their lashes. It has Velcro in the back. These are great for traveling. I love them myself, but I think especially when they're in labor, this is great because they can kind of shut off the world and just be in labor land and do their own thing. So it's a wonderful, wonderful tool. And when I have women on their side lying, I will put the 40 Blinks on them with the tissue for sanitary purposes. So this is a picture of one of my past clients, and she is enjoying what I call the queen throne position, because I feel like she looks like a queen on the throne. So this is that awesome adjustable table. So I elevated the back for her level of comfort, have a pillow underneath, and then have a bolster under her knees. Very good position if you were doing breech baby treatment and that kind of thing. But they're very comfortable with that. So if you don't have that kind of table, to make sure that you get those kind of pillows that you could create that kind of situation. They have wedges, which are kind of like triangular pillows, which could also help with the elevation and such. So here on the left, I'm showing, this is a very common way I would treat pregnancy is side lying. And so what I have them do is put their bottom leg straight, top leg bent. And that way you can access the yin side of one and the yang side of the other. You can get to her glutes, to her back, to her head, ears, face, whatever. So that's a very common way of doing it. Some women will, they're told to only lay on their left side because of blood flow issues. For a lot of my healthy patients, this woman was particularly coming twice a week as she was approaching her due date. When she's 38 weeks, that's usually my recommendation. And so she would do, Mondays on her right and Wednesdays on her left. Like that was kind of how we did it there. And then the picture here on the right was me doing what's called a double hip squeeze. It's basically like GB30, you're squeezing in. And that's so helpful for pain relief, for back pain. This was a full-term pregnant mama, so I was just trying to help her. And I was also her doula. So this was something I would do a lot in a labor situation. This is literally their epidural is you doing this for hours if you attend births. So another thing with acu and pregnant ladies is this fear of liability. So, I think it's the fear of liability of doing the acupuncture, definite fear of prescribing herbs. So some of the things that I like to share with that is one is, setting an intention. I was trained to do qigong, and before and after each patient, I kind of like clear the energy so that you really are present in the moment. But then I would do 20 with all my pregnant ladies. And I would say, this is the hold the baby in point. And we're going to do this point every single time until you reach term. And just so you know that I'm not doing anything to jar this pregnancy, that we're kind of like working together to help hold the baby in. So that is great. People love it. And it's just a nice little touch to add. And then the other thing is making sure that you have proper insurance coverage. So this is who I recommend. I don't get anything for referring you to this, but this is the company that will cover you for treating high-risk pregnancy. If you're planning to treat labor and delivery, definitely none of the other ones cover that, or they say it's like $10,000 per birth. It doesn't make sense. So you can switch out of whatever company you're with. And if you are working with this perinatal population, I would highly recommend it. Okay, so in terms of TCM tips for pregnancy, one thing to do is just, it's like, keep it simple. What do you see? What do you feel? Tongue and pulse? What are you observing? Okay, she's spleen deficient. So in working with students at the colleges, I find that a lot of times they overcomplicate things and they want to put in 25 points. No, a newly pregnant woman, no, no, no. We're going to do 8 to 10 points. We're limiting the number of points. We're making sure she feels safe and comfortable. Maybe if you're doing the hold the baby in, you could start at the bottom and go the way up, but I would do 20 first. Another thing to consider when you're treating pregnant mamas is involving the partners and having them come in to the clinic and supporting them. So I like to share tips for labor. And so I talk to my pregnant women about, I love for you to bring your husband, your partner in once you're towards the end, and we'll bring them the first 10 minutes or the last 10 minutes, no stress. And then you show them LI4, spleen 6, the bilao, or like showing them GB30, double hip squeeze. And what I found was that was so beautiful, like wonderfully received, especially during COVID when they weren't even allowed to go to the doctor or midwife appointments with their partners. So they were incredibly grateful. And I just think it's a little thing. And so, if you want to show pressure points at a different point, but that has been really helpful to involve the partner as well. So these are the pregnancy disorders that Chinese medicine supports. And so I have been able to work with all these different things, and we'll talk about a couple of them here today. But this is, so amazing to me, is like there's so much Chinese medicine can do. And, God bless Giovanni. I have his book. I have all the books, but I feel like there's so much more that needs to be taught in this pregnancy world, because there is so much we can do. So breech baby, probably about an 80% success rate with breech mamas. So when the baby is malpositioned, I'm able to do Moxa UB67. This is the position I would typically like her to be in while doing it, and would have them follow up with treatment at home, 10 consecutive days, 20 minutes a day. And so it's been beautiful to help people have a shift. And then, if the baby doesn't shift for whatever reason, they feel like they tried everything before they go to C-section. So it's really wonderful to be able to do that. There is a lot of talk about this and evidence about this. So at least you should be promoting breech babies. IUGR stands for intrauterine growth restriction. So I had this patient come in at 20 weeks one time, and she was hysterical. She was 20 weeks gestation, just crying so much. And she said she went to her doctor, and her doctor told her that her baby was small and was going to die. And that if the baby didn't die in utero, it was definitely going to die during labor. And if it didn't die during labor, it was going to die as soon as it came out. Terrified this poor lady. And so when you have diagnosed with IUGR, it's in the 10 percentile or less. So baby was measuring small. And my perspective, she was blood deficient. She was kidney deficient. So every week I saw her for the rest of her pregnancy, tonified her kidneys, build blood, put her on herbs. And she gave birth spontaneously, 38 plus 6. And this was her baby, shared with permission. So it's really wonderful to be able to help turn those horrible situations into, better results or better options. Placenta previa is the only disease that I actually have 100% success treating. And I'm writing an article on it and doing a class on Net of Knowledge soon. Anyways, it's just amazing to me and mind-blowing. So placenta previa is where the placenta is low and covering the exit, the cervix. And so a lot of times this is spleen Qi deficiency turning into spleen Qi sinking. So you put them on Bujang Ichi Tong, you tonify their spleen, you talk to them about the importance of, sitting down while you eat, eating every, so many hours. So that's especially important for the moms with other babies, because they're always just, running and going. So it's incredible that nobody talks about this. I can't find any information on this. And so I want to share with the world, like, you can treat this. This is so amazing. So look for more information to come on that. Pregnancy loss, so sad, but 1 in every 4 pregnancies does end in loss. So if you're going to work with this population, you are going to, that is going to happen. I have a class again on Net of Knowledge on pregnancy loss, but this is something that I really is near and dear to my heart because of my own loss. I always get those calls when other people lose babies, but it's because I care so much and I really want to support them. So I had a situation a few years ago. I was at Symposium one weekend, the annual conference that they have, and Jill Blakeway was speaking, and she did a class on how to prevent a miscarriage. And I got a call on Sunday night after Symposium, or at the end of the Symposium, and this girl says, "Hi, I'm 13 weeks pregnant. My bag of water broke, and my doctor told me to abort, and I'm a religious woman. There's no way I'm going to abort. Can you help me?" And I said, "Absolutely." And I went to her house and I did a home visit, and her bag resealed per her perinatalogist, and she carried to almost term, and this is Hobie. And she went on to have a second one. Like, unbelievable, this, what we can do. So I love to attend births. I'm such a birth geek. And so acupuncture and doulaing, where you serve as a labor coach, you're helping the mom, her partner, anybody in the room through it. This was a fun situation. I had attended this woman's first birth, and she wound up having a 48-hour labor. And so this was her second labor, and she was determined to make it 8-hour labor. And so I brought a colleague with me. And so my colleague Grace is here holding Yin Tong. And so what Grace and I had determined was Grace was the acupuncturist and I was the doula. And I would tell her when to do points or what to do, but like that I was doulaing and she was acupuncturing. And it's kind of easier that way because acupuncture is a medical role and a doula is a non-medical role. So when you're playing both, it can be challenging. Anyways, so she gets out of the tub after this. She gets checked. She's about 7 or 8 centimeters, and she's like, "Help me, I'm miserable." And so I said to Grace, "Do the buy loud points." Now, when I'm serving as an AcuDoula, and I'm the only one, I can usually only have time to get like 1 or 2 of those in before the next contraction comes, and I have to be in front of her and helping her breathe and all those things. So she was laying down. So I told Grace, "Do the buy loud points." Grace did all 8 in like, no time. And the woman literally gave birth 12 minutes later. Amazing, amazing. Those bilateral points are very strong. And here is the beautiful family with the beautiful baby. And her birth was 8 hours and 15 minutes. So it was very cool to witness. So our support and continuity of care can really help change the women's pregnancy and birth from a more fearful one into a more positive experience. So imagine what that could do for our society, for family bonding, for all of these horrific, statistics that I talked about. So, how can we help change that for them? And if not us, who? Like, I don't even know. So I feel like there's so much we can do. These are examples of things that I can do with Chinese medicine, that we could do in Chinese medicine in a Western medical setting. So UB67 is unbelievable. So if a baby's heart rate drops, you can tap on UB67 and it pops it right up every single time. Now, in every birth I've ever been in, like the 250 births, there always is a decel in the heart rate when the birth becomes imminent, as the baby's head's getting squished through the tube. So that does seem to be, common and part of the process. However, some hospitals are more quick to C-sect. So for example, in this situation, this was a 24-year-old woman having her first baby, wanting 5 children, and perfectly healthy, was a runner, everything, no problems in the whole pregnancy. And these decels start happening and they start talking C-section. And so I was like, oh my God, so I put an ear seat on the one side for the dad. I just dug my fingernail on the other side. And anytime there was a decel, we would do that. And so it helped the heart rate pop up. It helped her deliver vaginally and everything was fine. Another thing we could do is large intestine 4. When you have a woman hooked up to the tachometer, they're on that monitor with the 2 straps around their belly. So what that is monitoring is, one is the baby's heart rate, and the other one is how often and intense the contractions are. So if you see contractions kind of looking jagged, like liver cheese stagnation kind of thing, you could squeeze LI4 while she's having a contraction and you will watch it just smooth right out. It's amazing. It's so cool to be able to watch on the monitors. So things like hip rocking, kidney chafing, all these things can be used, which is, tui na that we learn so easily. And then I teach things like navel cupping and moxosacral fan, very easy techniques to learn that can be incredibly helpful. I talk to all of my pregnant women about postpartum. I drop those little seeds of, oh, did you know I could treat mastitis? Did you know we do C-section scar recovery? Since 1/3 of the women are, these are important things to discuss with them. And that way you can, just drop those little hints so they know when to come back. People don't think about coming to see an acupuncturist with mastitis. So it's really important that you talk about that. Earseeds.com came out with this really cool postpartum kit where they sell and they have the points for low energy, for pain, for mood disorders, things like that. So I like to sell my pregnant patients this kit. And that way, when they have their baby, a lot of times we don't see them very much. And so if, so it's just nice for them to have it. And then they're texting me like, oh, I'm having this problem, and say, hey, put it on these points. You could send pictures or, link to whatever. Great idea. So in summary, most of us did not learn in school how to confidently care for our pregnant patients. And this is really what we need. And this is so important that we're actually feeling confident treating these pregnant women, all through their pregnancy, birth, and postpartum. So imagine a shift in your practice. You extend your knowledge beyond fertility by not only helping your patients get pregnant, but staying pregnant, carrying to term, preparing for a safe birth, and then healing safely postpartum. And then for some, repeat over and over and over. This picture was awesome. This was a woman who was coming to me for infertility. She was kind of at that age in her 30s where all her friends were pregnant and she was miserable. And so she was doing CrossFit. She was CrossFit, so extreme exercise 5 days a week. She was fit, she was in shape, healthy. So I said to her, would you be willing to tune down, the volume of the CrossFit? Would you be willing to do yoga instead of CrossFit? Or only go once a week instead of, so explaining to her, you only get so much energy in your body. And in 2 months, she naturally conceived twins and gave birth successfully to twins. So very cool. Imagine the what not to do for your pregnant patients, and all the contraindications becomes full of protocols on this is how I treat pregnancy. This is how I treat birth and postpartum. So what if our fear of treating pregnant patients transforms into complete confidence? Imagine you no longer are referring those pregnant patients out because you know how to treat them yourself. So I want to introduce and share with you guys something I'm really excited and proud about is our PUSH Professionals Mentorship program. And so this is a 24-hour program. We meet once a week for 12 consecutive weeks. I work in conjunction with Net of Knowledge. So that's where you get the CEUs. So we do 1 month all about pregnancy, 1 month all on birth, and 1 month all on postpartum. In addition to those 2 hours recorded, you have them for life, Zoom classes. Also, once a month, you and I will meet on Zoom or on the phone, one-on-one, and we can talk about your practice building questions, challenges. We can talk about case studies, all sorts of things. And I really like to make myself extra available to you during the mentorship program. I take, just a handful of professionals to work with and really train them. I want to help you guys become the go-to person in your area and learn how to specialize and, do this thing. We have awesome guest speakers. I have Dr. Catherine Austin, does all the herbal portion of the program. And then we have midwives, pelvic floor PTs, all sorts of awesome speakers. So this was just a testimonial from past mentees. I had one lady, she was so lucky. She had a OBGYN contact her directly because she had treated a patient in school and asked her if she wanted to rent a room from her office. Well, this girl just came out of school and the doctor says, I just want to open the floodgates of pregnant ladies on you. And this girl was like terrified of treating pregnancy. And so after 3 months of working together, she was no longer terrified. And then another person got to see so much confidence building, and then it was also increasing her business after just a couple months. So it's something I'm so passionate about. I'd love to share. This was Kimberly. She gave a little testimonial.
So I wanted to tell you that the course that you're teaching so far, it's only been 3 classes. I'm blown away. Like the information you're telling me, it's not stuff you would think of. It's like way more. You add points, all kinds of ideas for positioning women in pain and depression and even nausea. I'm like, this is like a dictionary of how to take care of a pregnant person and delivery. I can't even wait to finish it. It's so good.
So that was fun. Let's see. And so I would love for you guys to join me. Our next cohort is starting in January of next year. This is our scheduled time. And I would love for you guys to register today. I do have early bird pricing. If you type in the code fall23, you would get $200 off the pricing. what do treatment plans look like? Somebody said more around IVF, more during week 38 and on. So the Push Professionals is all about pregnancy, birth, and postpartum. I feel like there is so much information out there on fertility. I do drop little tips and hints, but it's really 1 month is all about pregnancy, 1 month birth, and 1 month postpartum. So I hope that answered your question. Yeah, so this is you type in the code fall23, you get $200 off. I would love for you guys to join me. We have a great group starting in January. There's lots of people that have done it so far, so you could ask around. If you have any questions and you want to just chat with me, just book a call, and I'm so happy to talk to you and spend time and get your questions answered and see if this is a good fit. So I would love to talk to you. You guys, please reach out if you have any questions. And if anybody has any questions, I am happy to answer them. Please feel free to subscribe to my YouTube channel if you have not already. And I look forward to seeing you again soon. Thank you, guys.